Hello, welcome to week 3 of the Nursing Leadership and Management course. The lecture for this class for this week consists of 3 parts. These will be presented in this order: the legal and ethical aspects of leadership and management, the decision-making and problem-solving in nursing management, and management of stress and time. Before I start reviewing the legal and ethical issues in nursing management, let me go over the objectives of today's class. By the end of this class, you should be able to understand the legal aspects of assigning, delegating, and supervision for the nurse manager accountability, the legal aspects of staffing issues, the role of the leader and manager in making decisions, the decision-making and problem-solving process, types and signs of stress, managing time and stress, and managing interruptions to stop time loss. Assignments, delegation, and supervision. Failure to act prudently in creating assignments and delegating tasks to others and improving supervision may result in malpractice. Assignments are a transfer of both accountability and responsibility from one person to another. What this means is that just as we are thoughtful in determining what patients need and what our priorities for care are, we must be thoughtful when we create assignments for others. For example, we are creating assignments that we know someone could not accomplish or that are beyond the person's knowledge and skills. We must also be thoughtful in delegating tasks to others. For example, we must be clear that the delegatee knows when to seek help and what to report, and we must be thoughtful in providing supervision to others. For example, asking, "How are the things going?" is insufficient except in the rarest of cases where two people have worked together and know the honesty and proactivity are inherent in the persons being supervised. So, to avoid concerns of malpractice, we must be cognizant in our best communication skills and observation skills to assess and judge how others are accomplishing their work. Assignments do not confuse the typical assignments that are made at the beginning of a shift with this term. This term refers to the legal context when another person assumes both legal aspects of care, accountability, and responsibility. Thus, it refers typically to the relationship between two professional people. It is clear that the person makes assignment must know the team members as individuals to make accurate assignments. The individual also has an accountability when given an assignment that is beyond the individual ability to execute. It also must involve speaking up and defining what issues exist in completing the assignment. The term delegation, and delegation is a complex process that basically keeps the delegator, the registered nurse, accountable for tasks that another person performs. The other person, the delegatee, has been authorized to perform a designated task or set of tasks and assume the responsibility for performing that task in the best manner possible. Again, the delegator must know the abilities of the delegatee, and the delegatee must be able to define any limitations to perform the tasks assigned. And supervision entails observation and communication. It requires creating judgments and providing feedback. For the judgments to be correct, a dialogue about the care being rendered and system issues that are complicating that care delivery must occur. Doctrine of Respondent Superior. This includes knew or should have known as the legal standard in assigning the delegating. What this means is if the manager or immediate supervising person made assignments or delegations appropriately and had no reason to believe that the person accepting the assignment or delegation was unable to perform adequately, the liability is minimal or non-existent. The opposite is also true. So again, thinking cautiously in assigning and delegating and knowing how others are prepared and typically perform are important. What you see in this slide is related to the elements of accountability. Now think about each of these elements to determine if you are aware of how to know each element. Be aware of others, knowledge, skills, and competencies. Know if others are maintaining their performance levels. Know the standards to which we are held accountable. Know what the practice acts require in terms of accountability for others. To be practical, here are some questions you can ask yourself about another individual in your team. Is this staff person new? Has he or she completed orientation to the organization or unit or the ship? Has this person participated in orientations to new equipment and procedures? Has this person been adequately supervised? Do I concur with the evaluation about performance? The failure to warn concept is an avoidance of liability. If patients chiefly to administrative person, but there are many states that require through their peer review processes that individuals suspected of addictions, violent behavior, and incompetency be reported by professional colleagues. For example, if a registered nurse witnessed violent behavior on the part of another registered nurse, many states require that the first registered nurse report the incident to the State Board of Nursing. Managers, through their actions, are preventing others from hiring an individual suspected of harmful behavior without knowing that such conditions exist in the current employment situation. Most states recognize qualified privilege so that current employers can share factual, objective information with prospective employers without violating confidentiality. This is true only when the person seeking a new position has cited the prior employing organization or manager in the application process. Probably no other area is so controversial as the area of staffing. Part of this is due to the fluctuation in patient census and part is due to the shortage of qualified staff. Matching numbers and qualities of staff with the needs of patients is always a challenge. There are three key areas related to staffing issues: staffing levels, floating staff, and use of temporary staff. We're now going to discuss each separately. Most staffing levels are not specified in terms of numbers. Thus, the challenge about staffing is that understaffing is always determined in court on an individual case basis. The mandate from groups such as the Joint Commission and others is that adequate staffing is maintained. The challenge is that there is great discussion around that term, adequate. The adequacy is based on patient acuity, but there is considerable debate about the accuracy and flexibility of the systems that exist to measure acuity. Actual numbers of people is one consideration. The next is the mix of staff. Are there sufficient registered nurses to provide the required standards of care? Is the ratio of RNs to LPNs or LVNs appropriate? And what about nurse assistants? Most literature since 2001 has supported the idea that the number of registered nurses available to patients makes a difference. And if you have indicated that additional educational levels for the staff correlate with better patient outcomes. Being proactive as a patient-side nurse or as a charge nurse or manager is important. If staffing is insufficient, the concern needs to be expressed to the next level of management so that the immediate need is known and also so that the next level of management is aware, so that the longer range implications of budgeted position, for examples, are known. When staffing levels are insufficient, everyone should be concerned. Anyone can document the staffing levels and what the issues are about the levels. Using the chain of command, the next step is to report a concern to the next level of management. This may be the charge nurse who might be able to alter the situation, but he or she often consults with the manager or supervisor to have overtime authorized and then to find someone able to return to the care setting. Reassignments of people almost always involves the supervisor unless the manager has accountability for more than one unit and the staff are prepared to cover both units. Restricting admission is a challenge because there may be no other place for a patient to go. So there may be a period of challenge before this action is helpful. After all, the patients that are creating the current demand are already there. It is important to follow the chain of command to the necessary level so that others beyond nursing know the challenges of the staffing levels. Floating is also known as pulling staff from one unit to another. When floating staff from one unit to another, it is safest when a cross-training program exists so that the person being moved from Unit A to Unit B is also familiar with the care standards of Unit B. Sometimes this requires moving multiple people to capitalize on the staff's abilities and patient's needs. Thus, to fill a need on Unit B, the nurse from Unit A may have gone to Unit C, from which a nurse went to Unit D, so that nurse on D could go to Unit B. You can see how complicated that can be. Apparent agency comes into play because courts have now viewed that the temporary employee has, in a sense, held himself or herself out to be acting on behalf of the organization. Thus, a patient wouldn't know necessarily that Nurse A was a hospital employee and Nurse B was an agency employee. The patient sees two nurses available to provide care, while an agency nurse may be very clear about who the employer is. This may be difficult for patients to grasp due to many factors, including the stress of hospitalization. Hospitals do not relinquish liability because the hospital is accountable for the patient who have sought care there. The hospital, through its regular employees, controls which patients are assigned to agency staff and evaluates the performance of this agency staff. The same expectations and questions asked about new employees apply here. Whether the temporary employee or worker is a nurse or an assistant, it is important to perform the same supervision as with regular employees who are new to a unit. The inability to perform must be reported to the nurse manager, who should report such to the agency. The manager should also know to refuse to accept this individual's services in the future unless sufficient documentation supports a change in performance level. In summary, staffing a unit or even a shift is a challenge. It is a complex process of matching numbers of staff with needed abilities to the needs of the patients at the time. It requires substantive judgment, the skill expected of a registered nurse. Now let's go over the second part of today's lesson, which is related to making decisions and solving problems. No matter what our role in nursing, we are constantly involved in making decisions and solving problems. All of us have made decisions and solved problems in our personal and professional lives. What then is the difference in these two topics from a leadership and management perspective? That is the focus of what we are going to discuss. Not all decisions begin with problems. Before a problem is presented, we often have multiple choices for action available to us. For example, a nurse leader might engage a group in making decisions about how future nursing care should be delivered. There is no problem to be solved here, merely opportunities to think creatively. Problem solving basically involves needs. Problems are staffing shortages, insufficient supplies, too many assisted personnel, and so forth. Problems are immediate choices to be made, and they are usually based on closing the gap between reality and the desired. Although one way to solve a problem is to reframe the desired, usually the real choice is to alter the current reality to better approximate what the desired state should be. There are two types of decisions. The first type is known as satisficing. This is when good enough is the right answer. For example, if two products are essentially the same and one is more expensive because of some extra dials and knobs that aren't essential to quality care, a satisfying decision would be appropriate. On the other hand, if you are hiring a new evening staff nurse and this person has to perform at a high level quality, the decisions for shaping the advertisement, the recruitment plan, and the interview process need to be optimized because you want the best possible person. The two types of decision-making styles often reflect your management or leadership style. An autocratic decision is one where an individual decides and announces the decision. While this may have to happen in some situations due to confidentiality of information, it is usually not as effective as a democratic style. That style requires group input. While a decision may look attractive from one perspective, it might be a nightmare from another. The value of having multiple views is that the decision usually fits more people's abilities and needs than if someone decides alone. If a decision is not going to be one of high quality, why waste the group's time? Even if all cannot embrace a decision, they should be able to at least accept it as a sound one and advocate for its implementation. Here are some characteristics of good decisions. Information is factual, complete, and relevant. Decision makers process the data. The decision is defensible, benefits outweigh liabilities and risk. There is a fit between the decision and the original need. Let's turn now to problem solving. Answering these questions can simplify some decisions. For example, if the answer to the first 5 questions is no, you have to decide what to do next. Is it important? Is it main? Am I qualified? Do I have the authority? Do I have the resources? Can I delegate it? What are the benefits of solving a problem? While we don't often think about ignoring problems, that is an option. Ignoring can also be thought of as a purposeful inaction. Refer might include giving the problem to your boss, or someone else who has the authority to solve the problem. Delegate suggests that you expect to stay involved in the process, but that someone else will have the responsibility for the solution. Consult is the strategy when you want or need to stay involved even though you don't have the authority to solve the problem. Collaboration is analogous to group participation in decision making. The decision-making process is one that is probably familiar to all of us. The difference in a leadership or management position is the nature of the problem we are dealing with. First, we may be looked at as the expert practitioner on the unit, so some of our problems may remain clinical ones. Second, we are now accountable for others, so some of their problems may become ours. For example, if the nurse providing care for a patient needs to monitor IV medications and no IV pump is available, it is the leader or manager's job to secure the equipment or problem solve with the staff to determine how to proceed with IV medication administrations for this patient. In conclusion, making decisions and solving problems are not the same process. However, both involve critical and creative thinking and are focused on answers that are either the best possible or good enough for the question under consideration. We are going now to focus on three elements of managing time and stress. Quickly, we will review the signs of stress. I know you all know them, but often we get so focused on everything we need to do that we forget to step back and assess the situation and ourselves. Next, we are going to talk briefly about some tips to avoid interruptions, things that often add to our stress. Then, we are going to talk about managing stress and time. In 2003, a Harris poll showed that there were considerable issues related to stress. Of American workers, 43% fear and anxiety, 33% physical ailments, and 27% personal emotional problems. Many of these issues resulted in accidents, absenteeism, turnover, diminished productivity, increased cost of insurance. In 2002, Tangri found that stress resulted in these percentages and negative employment situations. 19% of absenteeism, 40% turnover, 55% of employee assistance program, and 30% of disabilities, and 10% of drug costs, all due to stress. Although each of us might respond differently to stressors, there are some workplace factors that many of us respond to. Pettigrew says that there are two ways to look at job-related stressors. Some are external. These are the conditions themselves, such as workload, shifts, high patient acuity, workplace changes, ethical conflicts, job insecurity, and role ambiguity. The nurse experience role ambiguity when when her or his role expectations are currently unclear because of the added managerial role. Internal resources are those things we bring with us. Problems at home or at school, challenges of getting to and from work, negative self-talk, lack of social support, inability to make decisions, pessimistic thinking. These all contribute to or are responses to stress. Not every headache is due to stress, and feeling tired is a logical result of working hard. Yet, both of these can be subtle signs of stress. Also, when you or a coworker repeatedly say, "I don't care, you decide," unless the decision is truly inconsequential, this may be a sign of stress. While we cannot eliminate stress, nor do we totally want to, we can manage how to experience stress, what we do in response to stress, and our time and the choices we make. Stress prevention is key, and it starts with choosing the right place to work. If you had a bad experience during clinical situation, there is no need to decide to work there to overcome this experience. Move on. Figure out what the daily stressors are and then try to space them out, avoid them, or find new ways to respond to them. Don't forget the physical stress that is just as demanding as the psychological stress. Insist on equipment in the workplace that helps you do the work in a correct and timely manner and prevent injury. Time, in addition to the tired and true tip about eating right. Here are some other things to think about. Each of these can help us respond in a more positive manner when faced with stress situation. We also can seek assistance through counseling and employee assistance program. Take time for yourself, decrease use of caffeine and alcohol, gain positive social support, nurture sense of humor, reframe events, exercise, meditate. These are the top 5 stress management mistakes. Do any of these relate to you? Let's look for a bit at the first one. Poor calendar habits. How organized are you? Clutter, perfectionism, self-treatment, following others' expectations. If we think of a calendar management in the broadest sense, it really refers to managing the time we have in life to achieve what we want. Whether we are discussing calendars or schedules or hours or minutes, the key is that time easily escapes us. Ask yourself these questions. Are you doing too much? Are you able to say no? Do you procrastinate? Do you spend time complaining rather than acting? One of our biggest losses of time relates to interruptions. Controlling interruptions by being organized, focus on the urgent and important tasks, use some methods of time organization, use delegation effectively, and ask for information writing. First, however, ask yourself if it is your time, if it's your job to be interrupted. If it is, and it causes you stress, you need to find different work or change how you think about interruptions. Being organized doesn't prevent interruptions, but they often can be accommodated. If you aren't organized, the smallest interruption can become a disaster. Be sure to use delegation to maximize your effectiveness. Know what needs to be reported back and be clear at the onset how you will keep appraised of changes in patient status. Multiple things happen at once in clinical settings, so setting priorities and focusing on those keeps you goal oriented. Whether you use electronic device, or a piece of paper, use some kind of method for tracking your own time. Sometimes when we are immersed in a situation, we lose all track of time and then aren't sure what we need to do next. If someone wants to give you information, unless it's in response to a question you ask them to write it down and give it to you. When we become really busy, we may forget the information that wasn't related to the situation at hand. Remember that everyone has only 24 hours a day to live life. Successful people know how to use that time effectively for themselves and their work.